So we are going to talk about carbapenem as a drug class, and carbapenems, we know they're used for infection. And if we talk about the generic names, we see panem, it's repeated. So we know that looking at the suffix, we can group them together. There are different names of the drugs, but the suffix is common, so we can group them together, and it's easier to follow. And we know they belong to one drug class. And as a learning tip, we know that the first letter of the generic name is not capitalized, and if it's a brand name, the first letter would be capitalized. Now we're going to talk about some uses. So for uses, so all these different kind of drugs, they can be grouped together for the specific action. And so first, like imipenem cilacidin is used for abdominal and pelvic sepsis, and we already know we're talking about infection. So obviously, when we talk about the uses, it's going to be different kind of infections, but the basic remains the same because we are talking about infection. And then if we see imipenem, cilacidin, and relebactam, they're used for hospital-acquired bacterial pneumonia and ventilator-associated bacterial pneumonia. And it is used to treat complicated UTIs. UTIs means urinary tract infections, and for CIAI, which is complicated intra-abdominal infections. So here we see we will always come across different kind of abbreviations, and it's always a good idea to just give a little bit of extra time to go over what the abbreviation means and what's the meaning, because it can help us in the long run, because these words will keep repeating. And when we know the meaning of the abbreviation, so in the long run it can help us to understand it in a better way. So then meropenem, it's used again gram-positive bacteria. Another learning tip, we know that the different kind of bacteria, they stain as purple or as a pink or red one. So gram-positive, I have highlighted in the purple. So just looking at the color, we can keep this in mind. Okay, this is purple, so it stains purple. It's talking about the gram-positive bacteria. So then we talk about verbactam. It's used in combination with meropenem, and it's also used to treat complicated UTIs, and including pyelonephritis. As I just said, just looking at the word, when we break the word and we try to look at the meaning, and sometimes we need not to even think hard. Just looking at the word, just breaking it down, we can get the meaning. For example, here, itis, as we know, itis means inflammation. And then nephro is related to like nephron. We know it's a part of the kidney. And pyelo is a renal pelvis. So just breaking down the word, if we see like pyelo, nephro related to the kidney, and itis is the inflammation. So we know it's talking about some inflammation in the kidney. So that's how while breaking the word, and when we know the meaning of the different word roots and prefix and suffix, so we know what it's talking about. So it's more understanding, and it makes more logic. And then adapanem, it's used for abdominal, skin, UTIs, pneumonia, and pelvic infections. So as I said, here we are going to talk about different kind of infections. Like the basic remains the same, because we are talking about infections, and all these drug classes, as we see, belongs to the same class, carbapenems, and it may relate to the different kind of infections and different kind of bacteria too, because infections mostly they're caused by bacteria, and bacteria are a very common cause of infection in human body. So this was about the uses, and next we are going to talk about some admixture. What do we mean by admixture? Admixture means when we give the medications, we should know like how, if we can mix them or we cannot mix them. So do not mix. So we are not going to mix with another drug, but imipenem, cilacidin, they can be given at the same time with another drug. So here we should know the difference, what it means. So for example, we are not, if we are going to give the drug in a syringe or something, we're not going to infuse or mix them together, but yes, we can give them separately at the same time. So it's very important that we know the specifics about how to give medications, because because it can cause a lot of side effects if we don't know the right route and the right time and how to give it in the right way. Like also they talk about carbapenem. So it can be given with 1% lidocaine injection and without epinephrine. And so carbapenem, as we see, it can be mixed with 0.9% sodium chloride, which is normal saline, but we cannot mix it with dextrose solution, because as we see, dextrose solution is a very common solution used in the medical field. And but we should know, like for the specific medications, that we cannot mix, for example atropine, we cannot mix it with dextrose. So we can use 0.9% sodium chloride, which is also called normal saline in this case. So what is the therapeutic effect? Because here we are talking about infection. We are giving this drug for infection. So obviously we want to eliminate the bacterial infection. And for this, for any kind of drugs, we need to be sure that we have to assess and we have to take care of labs. So here also, whenever we talk about giving any drugs, we know some basics are always same. We are always going to check vitals. We should know if the patient is hydrated, if any allergies. So these are the basics, and we need to follow. And we also need to see if there is any certain or specific thing we need to look for. So here with carbapenems, we should know if there is any history of seizures. And next, a very important thing is to look for any drug interaction while giving medication. We should know if any drug reacts with any other drug, and if there are any side effects. Or so like probenonic acid inhibits the urinary secretion of carbapenems, so we should know that valproic acid serum levels should be checked if used with carbapenems. And gansucor with imipenem and celestine can cause seizures. So for the medication purpose, we should know if the different kind of drugs are given together. So what are the changes in the physiological condition of the patient, what it is causing, what causes changing in the functional system in the body. So it is very important to know that. And so some of the side effects for this is a hypersensitivity, so which is a serious reaction, may require epinephrine, and it can cause diarrhea, blood and mucus and stool, dizziness, seizures, and phlebitis. So another learning tip here, like as we look at the word phlebitis, so we know, so for example, I don't know what it means. Okay, this is a weird word, it came here. So if I look carefully, so I know itis means inflammation, and flab means wane. So I can crack down the meaning of the word just looking at the word, just breaking it down. Okay, now I get it. It is inflammation about the wane, so I can know the meaning. And we know hyper will always mean more, and hypo always means less. So like this, we can crack the meaning of the word, and it's easier to understand. So these are some side effects for the carbapenems. And for example, the blood and mucus and stool, we know this is not okay. So side effects also, it's easier because we should know what are the normals. So we know the normals. If something is not normal, it means this is not okay. So we should know we need to take action, and we should also know when to report to the doctor. If there is blood and mucus and stool, we know it is not okay. It is not the normal. So we need to report to the healthcare provider, so the particular action can be taken, and the right measures to save the patient and for satisfactory patient care can be provided. So this was all about the carbapenems. Thank you.